Welcome to Cons Indo Bites, a channel to discover and learn. This is Dr. Vijeta, and today in this video, I will explain about electric pulp testing in endodontic diagnosis. The contents of this video include the concept of electric pulp testing, the types of electric pulp testers, the technique of use, the bridging technique of pulp testing, the responses and interpretation of results of EPTs, and finally, its limitations. The concept of electric pulp testing is that when we apply a low level electric current to the tooth to stimulate the A delta sensory nerve fibers within the pulp, the patient feels a tingling sensation. That means the pulp has viable nerve fibers. So basically, electric pulp testing is a pulp sensibility test and not a pulp vitality test. The different types of electric pulp testers are the benchtop of electric pulp testers and handheld EPTs. We also have monopolar and bipolar EPTs based on the number of electrodes. This slide shows the different types of electric pulp testers. These two pulp testers are handheld devices, and this is a benchtop device type of electric pulp tester. The different parts of the electric pulp tester include the probe tip, the rheostat which controls the flow of current, and a metal sheath. This pulp tester, instead of a metal sheath, has a lip clip. So the circuit usually includes the pulp testing device itself, the tooth. And the third part of the circuit can be the patient, sometimes the operator, or the lip clip, which helps in completing the circuit. When the patient is completing the circuit, he can just touch the metal sheath of the pulp tester, and this will complete the circuit. So the patient, when he feels the tingling sensation, he can remove his hand from the pulp tester, and also that indicates that there is a positive response from the patient. When the operator is completing the circuit, he has to touch the patient with the opposite hand in which he is holding the pulp tester. The lip clip is most frequently used nowadays because most electric pulp testers are monopolar, and the anode is the lip clip placed on the patient's lip, and the cathode is the probe tip placed on the tooth. So, coming to the technique of use. The first step is to explain the test to the patient so that the patient gets comfortable with the procedure. Then check whether the electric pulp tester is working. And always a disease-free contralateral tooth has to be checked first to get the reading and be used as a comparison before checking the test tooth. The next step is to dry and isolate the tooth. Proximal restorations must be insulated by inserting celluloid strips or pieces of rubber dam through their contact points. If this is not done, the current can flow to the adjacent tooth and the gingiva, resulting in a false positive response. The main electrode should be coated with a suitable conducting media, and the most commonly used conducting media is the toothpaste. The location of probe tip on the tooth surface is important to get an accurate response. In anterior teeth, it has to be placed on the incisal third of the tooth surface, and in the posterior tooth, it has to be placed in the middle third of the mesiobuccal cusp of molars, and in the case of premolars, on the buccal cusps. The current flow should be increased slowly to allow the patient enough time to respond before warmth or tingling sensation becomes painful. So, most EPTs provide a scale of responses. The scale can be something like between 0 to 80, 0 to 4, or 0 to 5. However, it is very important to remember that numerical values do not correlate with the severity of the disease. Let us have a look at the bridging technique of the electric pulp tester. Now, when a tooth is covered with a full coverage crown, then this technique can be used. In this technique, the tip of the endodontic explorer is placed on the tooth surface below the crown margin. A little amount of toothpaste is applied to the tip, and the tip is placed there. Next, a little amount of toothpaste is placed on the probe tip of the electric pulp tester, and this is then placed on the probe. The circuit is completed in the usual way and the results are noted. What are the different responses to electric pulp testing? The first is a normal response. A positive response is a response that occurs at the same neural excitation threshold as the control tooth. When the tooth response fails to respond even when the tester is set to the highest electrical excitation value, then it is called a negative response and it indicates a non-vital tooth. And when a tooth responds to a threshold which is less than that of the control tooth, it denotes a disease state of the pulp and it is called an early response. When a tooth responds at a significantly higher electrical excitation level compared to the control tooth, it is called a delayed response, and this also denotes a disease state of the pulp. The electric pulp testing is most useful on any tooth that fails to respond to a thermal test but a vital pulp is suspected to rule out a false negative response. So this situation most frequently occurs in case of teeth which have a lot of secondary dentin or calcifications because dentinal fluid flow is important for a response in a thermal test and in such cases, that is, in older patients and in teeth that have limited fluid flow, an electric pulp test can be extremely useful. And teeth with rarefaction without any obvious cause. For example, take a mandibular premolar, which seems to have the mental foramen superimposed, but we are not sure whether it is a periapical cyst or a mental foramen. In such case, a pulp sensibility test will be useful. Let us have a look at the false positive and false negative responses. A false positive response means even though the pulp is non-vital, the tooth is still responding to the sensibility test. This can happen in cases of partial pulp necrosis, liquefactive necrosis because liquid medium is a good conductor of electricity and gives a positive response even though the tooth is non-vital. Patients' high anxiety. Ineffective tooth isolation can cause the conduction of electricity to the gingiva and result in a false positive response. Contact with metal restorations. And similarly, in multi-rooted tooth, one of the roots might contain vital pulp, which can also lead to a false positive response. Coming to the false negative responses, even though the pulp is vital, the sensibility test is falsely giving a negative response. So this happens when there is fibrotic pulp. Extensive restorations and a pulp protecting base might prevent the conduction of electricity to the pulpal A delta fibers. Recently traumatized teeth, teeth with immature apices, drugs that increase the patient's threshold for pain, and poor contact of pulp tester to the tooth. So, why is EPT not reliable in immature teeth? This is because the myelinated fibers entering the pulp may not reach their maximum number until 5 years after tooth eruption or until they have been in function for 4 to 5 years. It may also be caused by the lack of development of the plexus of Rashko at the pulpodentinal junction. Also, it has been told that the larger pulp of immature teeth may cause impedance to the electrical current. So, can we use the electric pulp tester on patients with cardiac pacemakers? So it was shown by Woolley et al. When he conducted a study that electric pulp testers modify the function of the normal pacemakers. This experiment was carried out in dogs. So for many years, it was led to believe that electric pulp testers should not be used on patients with cardiac pacemakers. However, later tests showed that EPTs did not interfere with pacemaker functioning. This is because newer EPTs contain improved shielding and filtering circuits. In the year 2006, Wilson et al. Carried out an in vivo study in which they used EPT on patients with implanted pacemakers and showed that EPTs did not cause any interference. So, in the present day, we can safely use EPTs on patients with cardiac pacemakers. So, what test to use in what case? A combination of carbon dioxide and EPT is to be used as a part of routine clinical examination as pre-restoration assessment, trauma follow-up, and in to diagnose necrotic pulps. When both the carbon dioxide snow and the EPT give a negative response, we can safely assume that the pulp is necrotic. The cold test has to be used to diagnose pulpitis. It can be used to also differentiate between reversible and irreversible pulpitis before the placement of crowns and when the tooth has a crown to diagnose. Cold test can be used and also during orthodontic treatment. The heat test is to be used in cases of pulpitis in cases in which the pulp is responsive to heat. And electric pulp test is very useful in case of pulp calcifications. Coming to the conclusion, the most ideal way of performing a pulp sensibility test is a combination of cold test and electric pulp test. The diagnostic accuracy of the cold test is 86%, which is the highest, followed by the electric pulp test with 81% accuracy, and finally the heat test, which has an accuracy of 71%. Hence, clinically, a combination of cold test followed by electric pulp test is recommended. If you like this video, like, share, and subscribe to Cons Endo Bites. Thank you.